Nobody talks about the first 30 seconds after you open your eyes. Not your doctor, not any health advice you have ever read, not any wellness routine you have ever followed. Those 30 seconds are treated as nothing, a non-event. The passive transition between sleeping and being awake. And that assumption, that quiet collective dismissal of those first moments of the day, may be one of the most dangerous oversights in how we think about cardiovascular health in older adults. Because those 30 seconds are not neutral, not even close. What happens inside your cardiovascular system in the moments immediately after you wake up is one of the most physiologically dramatic transitions your body makes in any 24-hour period. And how you handle that transition, or more accurately, how most people mishandle it without realizing it, directly determines the level of stress placed on your heart, your blood vessels, and your brain at the exact moment when all three are at their most vulnerable. I am Dr. Julian Cross. I work in emergency medicine, and I have spent years studying the patterns that precede cardiovascular events. The circumstances that consistently appear in the hours and minutes before a heart attack or a stroke. And one pattern shows up with a frequency that I think deserves far more public attention than it receives. The majority of serious cardiovascular events in older adults do not happen during exercise. They do not happen during moments of obvious physical exertion or emotional stress. They happen in the morning. Disproportionately, consistently, and for reasons that are entirely explainable once you understand what your cardiovascular system is doing while you sleep and what it is forced to manage the moment you wake up. That is what I want to walk you through today. The actual physiology of what happens to your heart and blood vessels in those first moments of the morning. Why the way most people wake up places unnecessary and sometimes dangerous stress on a cardiovascular system that has not yet prepared itself for the demands of the day. And what a 30-second adjustment to your morning routine can do to meaningfully reduce that stress every single day going forward. To understand why the morning is so physiologically significant for cardiovascular risk, you need to understand what your body is doing during the hours before you wake up. Because the transition from sleep to waking is not a simple on-off switch. It is the culmination of a complex physiological sequence that your body begins preparing for roughly 1 to 2 hours before you actually open your eyes. During deep sleep, your cardiovascular system operates in a state of genuine rest. Your heart rate slows, your blood pressure drops. In most healthy adults, blood pressure during deep sleep is 10 to 20% lower than daytime levels. This reduction is so consistent and so important that cardiologists actually have a name for it. We call people who achieve this normal overnight blood pressure drop dippers. And research consistently shows that individuals who do not achieve this overnight reduction, the non-dippers, carry significantly elevated risk of cardiovascular events compared to those who do. The overnight drop is not just a byproduct of rest. It is an active protective state that your cardiovascular system enters specifically to reduce the mechanical load on your heart and arteries during the hours when your body is engaged in cellular repair and consolidation. But here is what changes in the hour or two before you wake up. Your body begins preparing for the physiological demands of conscious activity through a process driven by your circadian rhythm. Cortisol, your primary stress and activation hormone, begins rising sharply in what researchers call the cortisol awakening response. Adrenaline and noradrenaline begin increasing. Your sympathetic nervous system, the fight or flight branch, begins transitioning from the suppressed state it maintained during sleep toward a state of increasing activation. Heart rate begins climbing. Blood pressure begins rising back toward, and in some cases temporarily above, daytime levels. Blood vessels that were relaxed and dilated during sleep begin constricting. And critically, the blood itself becomes more coagulable, more prone to clotting. A phenomenon driven by increased platelet aggregation and elevated levels of clotting factors that follow a circadian pattern and peak in the early morning hours. This entire sequence is called the morning surge. And under healthy conditions, it is a normal and necessary process. Your body is essentially pressurizing itself for the demands of being awake and active. The problem is that this surge creates a window of elevated cardiovascular vulnerability that is unique to the morning hours. Blood pressure is rising rapidly. The heart is being asked to increase its output after hours of reduced demand. The coronary arteries, the vessels that supply the heart muscle itself with blood, are transitioning from a dilated to a constricted state. And the blood flowing through those arteries is more likely to form clots than at any other time of day. The research documenting this vulnerability is extensive and consistent. A landmark analysis published in the journal Circulation found that the incidence of acute myocardial infarction, what most people call a heart attack, is 40% higher in the first 3 hours after waking than at any other comparable period of the day. 40%. Stroke risk follows a similar pattern. Sudden cardiac death follows a similar pattern. The morning hours are not just statistically associated with these events. There is a clear and well-understood physiological mechanism explaining exactly why they cluster there. Now here is where the 30-second mistake enters the picture. Because the morning surge is already placing your cardiovascular system under significant transitional stress, and most people respond to waking up in a way that compounds that stress considerably, rather than allowing their body to navigate the transition more gradually. Think about what the average person does in the first 30 seconds after waking. Their alarm goes off. They go from deeply relaxed to immediately alert. They sit up quickly, often abruptly. In many cases, they immediately reach for their phone. They swing their legs over the side of the bed and stand up within seconds. This entire sequence happens rapidly, often before they have taken a single deliberate breath, often before they have given their cardiovascular system any indication that the transition is coming. And physiologically, what that rapid sequence triggers is a sudden and significant demand placed on a cardiovascular system that is already in the midst of the morning surge. When you move from lying horizontal to sitting up to standing in rapid succession, your heart must immediately compensate for gravity pulling blood toward your lower body. Blood pressure drops temporarily as your circulatory system scrambles to maintain perfusion to your brain. Your heart rate spikes in response. Your blood vessels constrict sharply. And if there is any degree of atherosclerosis, any narrowing or stiffening of the arteries, which is present to some degree in the majority of adults over 55, that rapid demand on already compromised vessels creates exactly the kind of mechanical stress that can trigger a cardiovascular event. The sudden surge of sympathetic nervous system activity that accompanies rapid awakening and abrupt movement also increases the risk of arrhythmia. Abnormal heart rhythms that in a healthy heart might be a brief inconvenience, but in a heart with any underlying disease can escalate to something dangerous. And the combination of elevated cortisol, increased platelet aggregation, rising blood pressure, and sudden physical demand, all converging in those first 30 seconds, creates a cardiovascular environment that is about as unfavorable as you can generate without doing something explicitly strenuous. This is the 30-second mistake. Not one dramatic action. A sequence of small physiological insults that stack on top of each other in the window when your heart and blood vessels are least prepared to absorb them. And the reason most people never think about it is that most of the time the cardiovascular system absorbs this stress without an event occurring. The body compensates. You feel briefly groggy or lightheaded, which most people attribute to just not being a morning person, and then you get on with your day. But the cumulative effect of navigating this transition poorly every single morning over years and decades is not neutral. Every morning of unnecessary cardiovascular stress is a morning of elevated mechanical load on the heart and arteries. And for individuals with existing cardiovascular risk factors, elevated blood pressure, high cholesterol, diabetes, prior cardiac events, or simply the arterial stiffening that comes with age, the margin for error during the morning surge is considerably narrower. So, what does a 30-second adjustment look like? And more importantly, why does each component of it work at a physiological level? Because I do not want you to simply follow a routine. I want you to understand what your body needs during this transition and why giving it those things changes the cardiovascular picture in a measurable way. The first and most important change is the simplest. Do not sit up immediately when you wake. Before you do anything else, before you look at your phone, before you respond to your alarm, before you move, spend approximately 10 seconds doing one thing. Breathe deliberately. A slow inhalation through your nose, a controlled exhalation. Just 2 or 3 cycles. This is not relaxation theater. This is direct physiological intervention on your nervous system. Slow, controlled breathing activates the vagus nerve and stimulates parasympathetic nervous system activity, which is the rest and digest counterbalance to the sympathetic fight or flight state that the morning surge is driving your body toward. Even 2 or 3 slow, deliberate breaths measurably reduce heart rate and dampen the sharp spike in sympathetic activity that accompanies abrupt waking. You are giving your cardiovascular system a brief buffer, a few extra seconds to begin the transition more gradually, rather than being jolted into it. The second component is how you move from lying down to sitting up. The cardiovascular significance of this transition is something most people have never considered. When you go from horizontal to vertical, your heart must immediately begin working against gravity to maintain blood flow to your brain. In a young, healthy cardiovascular system with elastic, responsive blood vessels, this compensation happens quickly and efficiently. In an older cardiovascular system with any degree of arterial stiffness, the compensation is slower. The blood pressure drop that occurs as you sit up is more pronounced, and the heart rate spike required to compensate is more significant. This is why orthostatic hypotension, the clinical term for the blood pressure drop that occurs with position change, becomes more common and more symptomatic with age. That brief lightheadedness or unsteadiness when you stand up too quickly is not trivial. It is a sign that your cardiovascular system is struggling to keep pace with the demands of a rapid positional change. The adjustment here is to make the transition in stages rather than all at once. After your deliberate breaths, roll to your side first. Spend a few seconds in that lateral position. Then push yourself up to sitting using your arms, rather than using a sit-up motion that engages your abdominal muscles and creates a brief spike in intrathoracic pressure that further affects venous return to the heart. Sit on the edge of the bed for a genuine 15 to 20 seconds before standing. Let your legs hang. Let your cardiovascular system begin adjusting to the upright position before you add the further demand of standing. And when you do stand, do it slowly and hold the bed frame or a nearby surface for the first few seconds. Not because you are unsteady, but because you are giving your blood pressure regulation system the time it needs to respond appropriately. This staged transition is not about physical frailty. It is about respecting the cardiovascular physiology of the morning hours. Research examining orthostatic blood pressure changes in older adults consistently shows that slow, staged positional transitions significantly reduce the magnitude of the morning blood pressure drop and the compensatory heart rate spike. You are not just being cautious. You are reducing a measurable and repeated source of cardiovascular stress. The third component addresses something that most people do not connect to cardiovascular health at all: hydration. When you wake up after 6 to 8 hours without any fluid intake, you are in a state of mild dehydration. Blood volume is lower than it will be after your first glass of water. Lower blood volume means your heart must work harder to maintain adequate circulation and blood pressure. It means the blood itself is more viscous, thicker, and more prone to clotting, which compounds the already elevated clotting tendency of the early morning hours that I described earlier. A glass of plain water within the first few minutes of waking is not a wellness trend. It begins restoring blood volume, reduces blood viscosity, and gives your cardiovascular system better working conditions at the exact moment when it is navigating the most demanding transition of the day. The temperature of that water matters less than simply drinking it. Room temperature or slightly warm water is absorbed more rapidly than cold water and does not trigger the mild vagal response that very cold water can in some individuals. But the most important thing is that it happens early, before coffee, before any stimulant that will further elevate heart rate and blood pressure, before your system has stabilized from the morning surge. Which brings us to the fourth component, the timing of caffeine. This one generates resistance because for many people, coffee is the first thing that happens in the morning, and the idea of delaying it feels unreasonable. But the physiology here is straightforward and worth understanding. Caffeine works primarily by blocking adenosine receptors in the brain. Adenosine is a compound that promotes sleepiness, and adenosine levels are highest in the morning after hours of accumulation during sleep. Blocking those receptors increases alertness. It also increases heart rate and blood pressure through sympathetic nervous system stimulation and direct effects on the cardiovascular system. Under normal daytime conditions, these effects are modest and well tolerated in most people. But during the morning surge, when blood pressure and heart rate are already rising rapidly, heart rate variability is reduced, and the cardiovascular system is already under transitional stress. Adding the stimulant effects of caffeine compounds the demand on the heart and blood vessels at the worst possible time. Research published in the journal Arteriosclerosis, Thrombosis, and Vascular Biology examined the cardiovascular effects of morning caffeine consumption in the context of the cortisol awakening response, and found that caffeine consumed during peak cortisol levels produced significantly larger blood pressure spikes than the same amount of caffeine consumed later in the day. The cortisol awakening response typically peaks between 30 and 45 minutes after waking. Waiting 60 to 90 minutes before your first coffee, after the peak of the morning surge has passed and your cardiovascular system has had time to stabilize, allows you to get the cognitive benefits of caffeine without layering its cardiovascular stimulant effects on top of the already elevated demands of the morning transition. The fifth and final component of this morning adjustment is perhaps the least obvious, but from a long-term cardiovascular standpoint, one of the most significant. Light exposure. Within the first 10 to 15 minutes of being awake, natural light exposure plays a direct role in regulating the cortisol awakening response and synchronizing the circadian rhythms that govern the morning surge itself. Research in circadian biology has demonstrated that morning light exposure through the eyes suppresses melatonin, reinforces cortisol rhythm, and helps calibrate the timing and magnitude of the physiological changes associated with waking. In practical terms, this means that getting natural light into your eyes within the first 15 minutes of being awake, by opening curtains, stepping briefly outside, or sitting near a window, helps your body execute the morning transition on a more normal and more controlled timeline. A body whose circadian rhythms are well calibrated by consistent morning light exposure manages the morning surge with less volatility than one operating in artificial light or darkness through the first hour of the day. Now, let me be direct about what this adjustment is and what it is not. It is not a substitute for medication if you have been prescribed cardiovascular medication. It is not a treatment for diagnosed heart disease. If you have existing cardiovascular conditions, these changes should be discussed with your physician, but they are not in conflict with any standard cardiovascular care. What they are is a set of behaviorally simple, physiologically grounded adjustments to the way you begin each day that collectively reduce the cardiovascular stress of the morning transition. Not dramatically on any single morning, but consistently, cumulatively, day after day for weeks and months and years. The cardiovascular events I see in the emergency department, the heart attacks, the strokes, the dangerous arrhythmias, are almost never the result of a single moment of excess. They are the result of years of accumulated physiological stress converging on a cardiovascular system that has been gradually worn down by conditions and habits and patterns that nobody addressed early enough. The morning surge is one of those patterns. It happens every single day. It places real stress on the heart and blood vessels every single day. And most people navigate it in the worst possible way every single day without ever thinking about it. 30 seconds. That is genuinely the scope of what I am asking you to change. 30 seconds of deliberate breathing before you move. A staged transition from lying to sitting to standing. Water before coffee. a delay in caffeine, morning light within the first 15 minutes. The individual changes are small. The physiological rationale behind each of them is sound, and the cumulative effect of navigating the most cardiovascularly vulnerable transition of your day more intelligently every morning for the rest of your life is not something I can quantify with certainty. But I can tell you what the research on blood pressure variability, on morning cardiovascular events, on the cortisol awakening response, and on orthostatic regulation consistently suggests: that the morning matters more than most people realize, and that small adjustments made at the right time consistently outperform dramatic interventions made too late. I am Dr. Julian Cross. If this kind of mechanistic clinical explanation is useful to you, please subscribe and leave a like. I cover cardiovascular health, metabolic disease, and long-term physical resilience from an emergency medicine perspective. The kind of content that explains why your body does what it does, not just what to do about it.